We have a helper saying that they can see us. So
Okay.
that's awesome.
Cool.
I know. Um, so all right. So yeah. So Dr. Pasternak, I'll pull up our notes and we'll start chatting all things tick-borne diseases. Do you want to start with a little bit about your background and kind of how you fell into knowing so much about this and being our go-to?
Yeah, sure. Um, when I was in med school, I ended up getting really sick, and I was a broke college student without insurance, so I just kind of let it go longer than I should have. And unfortunately, I ended up getting pretty sick with Lyme. Along the way, I learned a lot, so I think that there's a silver lining to it. Not that I would want to do it again, but I've seen lots of doctors along the way. I worked with an amazing Lyme specialist out in Seattle, which is where I went to med school, Dr. Marty Ross, who's a wealth of information. So I learned a lot from him. I've done a lot of natural treatments. I've seen conventional doctors, neurologists, ears, nose, throat, doctors, tried lots of different things, and luckily I am good to go today, knock on wood. But I have kind of been the guinea pig at the clinic, which has been fine with me because I would take any help I could get, and I was happy to have other doctors kind of give me random ideas to try along the way. And from going through all that, we've come up with some really great protocols that we found to be helpful. Some things we found to not be so helpful. So I'm kind of the go-to for Lyme and other tick-borne things now, which I'm happy to help. I know your pain if you're going through it, so I think that really is helpful too, to just kind of help analyze different cases and figure out what's really going on with people.
Yeah, no, it's been awesome for you to like take something which was like really intense adversity and turn around and be able to like kind of pave a road for others. And I've seen hundreds of patients through the clinic come through and meet with you and be really despondent. I think there's a lot of myths around natural treatment for Lyme that I'm excited for us to dispel. One is just from someone on the outside that doesn't do as much specialized with tick-borne diseases. It doesn't have to be gobs and gobs and gobs of supplements. I think that's definitely a myth that I see you being really like refined and critical thinking about what we have people on, so it's not your whole paycheck going towards supplements and like that upsetting your stomach by taking so much stuff.
Yeah. Yeah, I think part of us being able to figure out what's going on is to be really strategic with how we go about treating somebody. If we are going to recommend a person start on 10 different supplements and then we want to see how they're doing at the next visit, we have no idea what just did what. And unfortunately, with tick-borne infections, and we'll get into the lab testing a little more, but we can't fully rely on lab testing. So we do have to be good at creating a clinical judgment in terms of what's going on. And part of being able to monitor that and track that is to see how our treatments are working. And so I think just from more of like science method behind it, less is more sometimes. And also on the paycheck, it is really helpful if you're not spending all of your money on it, because I hate when I hear the cost of supplements be one reason that patients feel like they can't get care. So, the more affordable and realistic we can make plans for people, the more people we're able to help along the way.
Absolutely, yeah. And before we dive into like I know a lot of people have questions about the lab testing and stuff, which we can talk about, but I think another piece of it too is one of the things I love about your approach that you've refined is like really making sure that you're looking at the whole person and not just killing a disease state, not just squishing the bug, but also like looking at the host and what imbalances are there that we need to address to make sure it doesn't come back, you know what I mean?
Yeah, a question I get from people is, if you get bit by a tick, are you guaranteed to get Lyme disease? And no, you're not, because first of all, not all ticks carry the infection. But just say we have two different people and they both get bit by a tick that transmits the Lyme bacteria into their body. One person might never know. Their immune system might see it and fight it and get it out of their system. Maybe they felt like a little run down or whatnot, but they can carry on and have no acute or long-term symptoms from that. The other person, from a number of different reasons, they might get that same infection and be sick for months or even years. So we can't just treat the one thing. We can't just kill bacteria in a person's body and expect them to fully recover. Everyone's unique and everyone's different, and there's many things that feed into our overall well-being. And so we really have to treat everybody as an individual and make sure we're supporting their whole body, not just killing one thing that they might have.
Awesome, yeah. And so, speaking of individuality, do you want to chat about testing and how people respond, like what the testing is like and people's thoughts on it? I know there's a lot of like information, misinformation, different opinions on this, so.
Yeah, so there's lots of different bits of information out there, like Dr. Young mentioned. The standard of care is to do what's called a two-tier testing approach through just like whatever conventional lab. It starts with something called an ELISA, which is looking for the presence of antibodies. If that is detected in the blood, they will go on to do what's called a Western blot, which is looking at more small pieces of the DNA to see if that's there. There's a lot of issues with the testing. According to the CDC, and this was actually one of the questions that somebody asked us, is when you can get tested. But when you first get bit by a tick, we have to give the body time to create antibodies to even be detected. So if you get a tick bite, it's going to take about 3 to 4 weeks before we can really detect that in your blood, because the immune system has to do its job and start creating antibodies to fight that, and that's one of the things we're looking for in the blood. This is important to know because, and I'm sidetracking a little bit, but for people who get bit by a tick and they get tested right away, they might be told it's negative and they don't have Lyme. But if we haven't given the body that full window of time to even make the antibodies, it's kind of, not such a valid way to look at it. So we have to give the system time. According to the CDC, if we test within the first few weeks of a person getting bit, it's only about 30 to 40% accurate, which was pretty low. As it becomes later in the disease process, it's shown to be up to 70 to 100% accurate, which I think it's really hard to gauge, how true that is. But anyway, early detection can be hard in these situations. I guess I can go into interpreting a Western blot a little bit if you think now's a good time, because that's kind of a little bit of a discussion to dive into.
Yeah, I guess like the take-home message is that like the ELISA isn't like always the most thorough testing to do, because there's that false negative to it. Correct? Is that what you're saying?
Yeah.
Okay.
And that we just have to wait an appropriate amount of time before we can test.
Yeah. Yeah. And one thing that I remember us talking about is that even on the CDC website, it talks about, yes, testing is important, but there is a clinical picture that is presented with this. And so as we're talking all things testing and Lyme disease, that at the end of the day, a piece of this is a clinical picture, and so there are definitely scenarios where people may not test positive right away, but we're suspicious of it being tick-borne, and there's other ways we can kind of deduce what's going on, correct? Or thoughts around that? Yeah. Because I know some people get really disheartened. Their primary care will run an ELISA, it's negative, and so they're like, oh, you don't have Lyme. We don't. That's a quick jump when there could be some other concerns, correct?
Yeah, definitely.
Okay. But yeah, let's jump into talking about the Western blot, because that's like definitely a big question that we got some stuff about,
Okay. So a Western blot is basically looking at little fragments of DNA from the Lyme bacteria. A lot of people will say, well, you'll know what this test is because it's the one that has all the bands. Mm-hmm. A good analogy for this is you can think of all those bands like a barcode. So if we go into a store and there's two different shirts, they might be really similar, but we only know they're the same exact product if they have the same exact barcode. They can be really similar, but if they don't ring up the same, then we have no proof that it is actually the same shirt that we're holding, essentially. Mm-hmm. With a Western blot, each of those little bands is a little piece of DNA. So unless we have a certain amount of those pieces of DNA coming back positive, it's kind of like that barcode. We can't say that report definitively matches Lyme. It could be a little piece of DNA from some virus that we had a long time ago. So if bands come up positive, it doesn't mean there's a different infection we're missing. It just means, yes, our system has seen that little sequence before, but really we're looking for a big enough strand to say, okay, we know that what is in your body matches that of Lyme. And this is where a lot of confusion plays in, because we get the questions all the time, like, you know, I had 2 bands or I had 4 bands, but it's not enough to meet the criteria. So what does that really mean? Basically, according to the CDC, the Center for Disease Control, and they're the organization that creates a lot of the standards, it takes either 2 IgM markers or 5 or more IgG markers, and you don't have to remember that, but that's just what it takes to say, yes, this is definitively Lyme. Like, there's no doubt about it. Very low false positives, meaning like if that comes back the case, it's really likely that it is Lyme. So it, according to the CDC, that's what's needed to say it's a positive test. If that doesn't happen, if you don't meet that criteria, it doesn't mean you don't have it. And nobody can guarantee, like nobody can tell you for sure, is it actually there or is it not actually there, according to how that test is run. And in these situations, it is really important, like Dr. Young was saying, to be able to make a clinical judgment. Because even according to the CDC, a way to diagnose it is by clinical picture with the labs being used to back that up. So even if your labs are negative, that's not the be-all, end-all to say you do not have this infection. That information is supportive, because if it comes back positive, that's obviously really helpful. But still, we have to piece together what's going on with a person's history. A big part of this is also making sure we're looking at the whole person. So a lot of things will look like Lyme disease. A lot of things cause people to be tired and be achy and have headaches or whatever. You know, it could be a million conditions. So we don't want to have tunnel vision and just assume that's what's going on. Mm-hmm. So a part of an appropriate workup is making sure we're testing for these other things too. You know, other conditions that look alike, to make sure that's not what it is, and we're not just assuming that everything is a tick infection.
Yeah, I think that's a really important piece, because I think that, like, you know, when you're treating a lot of tick-borne disease, all of a sudden you see a lot of tick-borne disease, and then it's important to like look for the other things. I feel like over the years I've seen you catch so many other conditions and other things going on with people that are probably causing a lot of their symptoms that isn't Lyme, and that's just as important to make sure you're ruling it out as you're ruling it in. That makes a lot of sense.
Yeah. And sometimes we might think it's Lyme when it's something else altogether, but other times it can start as Lyme, and then along the way, all these other dysfunctions happen that are more like secondary to that infection, you know, so we kind of have to have both of those things on our radar.
Yeah, that makes a lot of sense. I mean, I think after being sick for a while, people get deconditioned. They have other things, imbalances that develop in their body that you have to address along with the infection. So it's a there's lots of layers to it for sure. So I love that you're very systematic about thinking about it. One question that was coming up is like the difference between doing a Western blot through a conventional lab versus doing it through, we'll leave names of companies out, versus doing it through a specialty lab where they may have to pay out of pocket, it may not be covered by insurance.
Yeah. So we do other types of testings. There's a few different other labs that we use, and I always take it on a case-by-case basis. A lot of that testing can get really expensive, and if a patient wants that test regardless of the cost, I'm more than happy to order it if it seems appropriate. But a big thing to know about that is it still has the chance to miss the infection. So if we run this test that costs $1,200 and it says indeterminate or maybe, we're right back to the same exact starting point we were before we ran that. So it's nice to have other options that are maybe a little bit more sensitive, meaning more likely to pick up an infection, but still we have to keep taking it with a grain of salt and still doing a good clinical workup.
Yeah, yeah. I'm looking through our notes. I also was just getting feedback from people about the sound quality, which is Fun fact for everyone who's here. By the way, we're Dr. Pasternak and Dr. Young, chatting all things Lyme disease. My office is in a what was a reformed utility closet, and and there is a Wi-Fi hub up right behind my desk, so it sounds a little bit like a wind tunnel because of me. So I'm gonna put myself on mute occasionally when you're chatting, just so we don't drown you out. I think we talked all those things. One of the things we talked about is the importance of testing co-infections. Can you talk about, so there's the Western blot to rule out or rule in, less than, not really rule out, Lyme disease itself, but there are other conditions that can be caused by tick bites and like infections that ticks carry. Can you talk a bit about that?
Yeah, definitely. In Connecticut, ticks commonly carry a few different infections. One is a bacteria called Borrelia burgdorferi, which is what gives people Lyme disease. But there's a few other ones that are common to this area as well. Anaplasma ehrlichia, which those two are pretty similar in nature, Babesia, and Bartonella. Those are always the ones I have on my radar. It's tricky because when a person gets bit by a tick or they suspect that they have Lyme disease, they might say that they got the blood work done and it came back negative. And maybe they don't have Lyme, but that doesn't mean they don't have one of these other co-infections, they're called. So other infections that can come, get transmitted by a tick. And oftentimes these aren't tested, maybe just like lack of general knowledge of what they are and what they do to people. But I think this can be one reason why people remain sick for quite some time, because maybe they don't have Lyme, but they have this active Anaplasma and Babesia infection that's going undetected, for quite some time. The important thing to know is they're not tested in the same way, so it's still a blood test, but it's a really specific test to look for that other microbe. And they're not treated the same way either, necessarily. Some of them are treated through the same antibiotics, some aren't, but on the natural side, they're definitely treated differently. So, maybe we think somebody has Lyme, and we're kind of treating empirically on that, and they're not getting better. That's a good time to kind of hone out our view and see what else could be going on. So is it another tick-borne infection? And if so, it makes sense that they're not getting fully better. And there could be multiple infections going on at one time too. So it's just about making sure we're doing a good workup through labs, a good workup clinically, and watching people as they go along to make sure if we're not getting symptom improvement, what else is going on that's kind of preventing them from getting better. I guess as I'm talking about that, the other co-infections, they do have a lot of symptom crossover, so a lot of those will mimic symptoms of Lyme, but they have some unique characteristics as well, and that's why we tend to have more lengthy discussions with people when we're doing an intake, just to ask a host of questions, even if they seem like they might be bizarre and unrelated, because sometimes we pick up on things that patients thought wasn't significant and they never would have thought to tell us, but that little insight and piece of information can be really helpful to us clinically to say okay, this actually really sounds like this other infection.
Can you give an example of some quirky symptoms that you think may not be related to a tick-borne disease but are?
Yeah, definitely. So Bartonella is another bacterial infection, and this one tends to live pretty superficial to our skin. So right under our skin, it likes to be in the connective tissue area. Because of that, people can get a lot of paresthesias or pins and needles types of sensations. And this is usually something people don't say unless you ask. But I'll say, does it feel like you have pins and needles, or feel like something's crawling on your skin? And usually people who have that will be oh yeah, it's this weird buzzing sensation or an electrical shock type of sensation. So that's one that goes along with that. That infection can also cause rashes that look like stretch marks or scratches under the skin. So people might think that they are stretch marks, but that's a hallmark for that condition. That one also is classic for causing pain on the bottoms of the feet, and that can look like plantar fasciitis. So if I'm doing an intake and people say, oh yeah, and I have plantar fasciitis, I always think about Bartonella too, to see if that could be what it is. Another one Babesia commonly has air hunger to it because that's a parasitic infection that affects the red blood cells, which is where we carry our oxygen. So if that's being impaired, some people feel like they have breathing difficulties or they can't get a full breath. So those are some of the random quirky things that we always screen for.
Awesome, thanks. So I think one of the things that is unique is talking about treatments a little bit. You know, I know some places have specific protocols or certain things. I think, you know, one of the unique things about how you practice is you have a lot of tools at your disposal, especially some newer ones that we have brought into the clinic the past like 3-4 years, namely low-dose immunotherapy. Do you want to talk a little bit about those?
Yeah, sure. So I do get questions usually from patients who are thinking about becoming a new patient, just wondering what protocol we follow specifically. I would say we don't follow anything specifically. We don't like go by the books of any one approach. And a lot of that is just trial and error from what we've seen work with people and what we have seen not work so well. So we really kind of customize each plan, you know, according to each individual. So no two people really get the same plan. But one of the things that we stumbled upon when I was sick is low-dose immunotherapy, which we have found to be incredibly helpful. We use it for a lot of different things, but honestly, out of everything we've used, I think that is like one of the most powerful things we have, for a few reasons. So one is that I feel like it really helps get to the root cause of the dysfunction that's going on. We don't just want to make people feel better, we want to really make people get better. There's a lot of things that we can add symptomatically to put out little fires to help, you know, reduce inflammation or help improve their energy. But we want to get at the root cause of what's making people feel unwell so they can get off of all their supplements and they can just really get to the other side of this. You know, we see it oftentimes so people feel better on antibiotics or herbal remedies, and as soon as they stop it, all their symptoms come back. So to me, this just says we're not really treating wholly the root cause. And that's where I think low-dose immunotherapy plays a part. So I have another fun analogy, because they're helpful. But I heard this described, this is not my analogy, but I'm going to use it. I heard kind of thinking about Lyme described as following. So say your body and your immune system is like a big field filled with mouse traps. And on each trap, there's a little ping pong ball. And they're just hanging out, ready to be activated. That's kind of our immune system, like waiting for something bad to happen so we can get on top of it. If you take another ping pong ball, which we'll say is Lyme disease, and you throw it at that field, all of those traps are going to start getting activated, and there's going to be like ping pong balls flying around like crazy. That is first our immune system doing its job, like that is it becoming activated, which is necessary. But the tricky thing about Lyme is that it tricks our body for lots of reasons, where even after we take away that one ping pong ball, all of that craziness is still going on. Like our immune system is still activated, it's still driving a lot of symptoms and creating a lot of inflammation. And this is something kind of unique to Lyme disease because it just complicates our body, where we're trying to fight it, but we're not always sure how to do that. So even if somebody has all that Lyme taken out of their system through whatever means, so we got that ping pong ball out, they're still creating a ton of inflammation. So they might feel just as bad as if they actually had the infection. And this is really tricky because then we don't know, are more antibiotics necessary? Do we need to keep adding more antimicrobial herbs? Or is the infection actually gone? They just still feel crummy because they're still super inflamed. So low-dose immunotherapy is great in this regard because what it is, it's all natural, it's really affordable, it's safe and gentle. It's a homeopathic mixture that gets squirted under the tongue, which works to desensitize the immune system. Basically meaning it's retraining it to kind of calm back down and just get back to its normal baseline level. And I do find this really, really helpful for people, and it can kick in so quickly too, which is a nice option to give people that relief.
Yeah, I think that it was a game changer. I know we were looking for something like this for a long time. When we found it in the clinic, it was like this piece that fit into our treatment protocol so beautifully.
Yeah.
And I like that analogy. I stole it from you. I gave you credit though, so somewhere else we have to give someone credit either.
Some other doctor somewhere.
It is the ping pong analogy. I think also is a great way to tap into like the what is a Herxheimer reaction and like is that something you address? But I feel like that analogy might like connect with Herxheimer reactions.
Yeah, definitely. So the Herxheimer reaction is what's also known as a die-off reaction, meaning if we have this bacteria or other things too, this applies to other infections like yeast overgrowths and whatnot, but basically if we have this infection in our body and we start killing it, all these little particles are going to start breaking open. Like all these little bacteria or all these little yeast cells are breaking open. And that is temporarily increasing what are called inflammatory cytokines. So it's our body and our immune system doing its job, kind of seeing these little fragments and trying to get it out of our system. That is a temporary increase in inflammation, which is a natural part of the course to go through this process. But with that being said, if we increase inflammation like that, we might feel a little bit worse as we go through that. Some people say like, okay, if you feel worse, it's a good sign we're on the right track, which I do use that information to see if we're on the right track. But with that being said, we're not trying to make people feel worse intentionally. A lot of people who have Lyme already feel so bad, like this is a big concern. How are they going to function at work? How are they going to keep up with their normal activities if they feel even worse? So there's a lot of things we can do to mitigate this, whether we do it at the same time as the treatment, or even sometimes we prime the body if we're really concerned about this, and do like a gentle cleanse or a gentle detox, get diet in a good place as like a precursor to even starting active treatment to try to make it easier for people.
Awesome, awesome. What else do we have on our to-do list? I'm going to toggle back to the other area just to see if I have any other particular questions or that kind of thing. Nothing. Whoop, there we go. Back to us. No major questions right now. As far as I'm looking through the questions we had gotten sent before too. I know there were a lot of questions about like other diagnostics. I'm not sure. We don't really use a lot of other diagnostics other than the clinical picture and lab testing in this office. So I'm not sure how well we could speak to it. There was a question.
One thing
Sorry,
I
go ahead.
touch on,
Yeah.
not to interrupt you.
Yeah.
Sometimes I do what's called a treatment trial. Basically, if we aren't sure what's going on, but we're pretty sure that it's Lyme or a co-infection, if the labs aren't reliable, we need some bit of information to gauge if we're on the right track. And if the labs come back negative, I hate to say, all right, well, you must not have it. Let's just kind of close the books on that and never consider it again, because we might be missing an active infection. We would never we wouldn't encourage trials of antibiotics because they come with a lot of negative side effects. But with the natural agents, they're really safe, they're really well tolerated, very minimal side effects, if any. So in these situations, sometimes we do like a treatment trial where we'll do a protocol, we'll put a cap on it. I'll say like, take these supportive remedies for about 3 weeks. Let's see how you do, meet back and kind of really pan it out. And again, this is one reason why I think less is more. Like we don't want to give people a million supplements because we don't know what did what. But if we really do a honed in treatment plan that is only going to affect a person if they have that infection, we can watch how they do. Did they get worse? Was that a die-off reaction? Did they get better, which is even better? Or did nothing happen at all? So sometimes we can use treatments to get people better, but also to get insight if we're on the right track. So I would say that's another way we try to sort out if we're on the right track and work around the lab inaccuracy.
Awesome. Yeah, I think that makes a lot of sense. And like you said, like you can kind of be empirical by doing that one piece at a time. I think we touched on a lot of the questions that people had sent us ahead of time. Looking over, I think we talked about treating the whole person. and I liked the treatment trials. Um, is there anything else that you feel like? I know one thing I should say is that this seems like a super complicated field because it is, and it's really nice to have someone on our team that specializes in it. One of the cool, I'm gonna promote your class for you. Dr. Pasternak put together this really comprehensive 3-part series online that's on our website. That is a great tool to know all the ins and outs of treatment options, those type of things. So that would be something to check out on the website. You can either buy one module or all 3, and it kind of brings you through the nuts and bolts of what if you get a tick bite, to what is all this stuff that we're talking about today, treatment options, other things, tips and tricks, treating the whole person. So I was really excited to see that we could offer that. And honestly, it can save people a lot of office visits and questions and help them navigate their health care. And I think it's an awesome way to empower people who feel a little lost in this field right now and are concerned that they have a chronic infection. So, if we didn't hit everyone's questions today, there's certainly probably something I know there's a ton I learned from watching your presentation, so I'm going to put a plug for that in as well. Is there anything else that you felt you wanted to touch base on today?
I don't think so. I think we hit a lot of it. I guess the only other thing is that we're grateful and lucky that we have a good integrative team at our clinic. We have naturopaths, we have acupuncturists, we have primary care doctors, so we really try to be collaborative. Good name for it.
Yeah, thanks.
And comprehensive, because again, no 2 people are the same, and we don't know what combination of treatments a person's going to need. Sometimes it's going to be physical medicine or acupuncture or nutrition. We have higher intervention treatments too, like IV therapy, to help with detox or energy. So, we really try to blend it, and if we feel like we're getting stuck with a person, or we're a team, so we're always collaborating together and always trying to pick each other's brains and just be really supportive as a team, so we have more to offer people. So we're grateful for that.
I know, yeah. Having the best of both worlds kind of in our office has been great, because if you feel like someone does need a little longer duration of antibiotics or a different antibiotic or low-dose naltrexone or other things like that, it's been really nice to be able to work synergistically for sure. So yes, I agree with you. We're spoiled. And so, it works out that we can help our patients so much more. So, well, I feel like this is the most time I've had with you since the pandemic started. Thanks for meeting with me. Thanks to everyone who's watched, who was patient with us figuring out the technical difficulties. Clearly not my forte yet, but we keep doing these, who knows. So thank you again, Dr. Pasternak. Yeah, thank you so much, and I look forward to chatting with you soon.
All right, take care, everyone.
Thank you, everybody.